Self-care strategies for women, particularly with respect to their mental health, are really critical. It is important at all times to be mindful of your own health, physical and mental, and they're both connected. So what you do for your body will also have a big impact in terms of positive sense, hopefully, on your brain and therefore your mental health. Such things as moving, exercise, becomes even more important as you hit the middle years, but is important throughout life. And middle and late years, women should look at the amount of exercise they're doing. Now, this doesn't mean that we all have to become weekend warriors and start lifting huge amounts of weights in the gym and so on. If that's your thing, keep doing it. But a good, regular, fast walk every day is very important for your physical health. And it's really critical that you make the time to do this. Yes, we're all busy. We've all got lots and lots of things, but we are important too in there. So make time, make space. Surely you can manage half an hour a day for yourself. And in terms of other things like eating is really critical. And it's unfortunate that we far too often just grab the quick, easy snack that's perhaps not really great for us. Yes, we're allowed to eat things that are not that great for us because everyone loves a treat, but don't make that the mainstay of your diet, because what you eat is really important. Good nutrition is very important. And I'd add in a third thing, which is fun. Too many times in my clinic, I see women rushing around trying to deal with their responsibilities as a parent of children, trying to deal with responsibilities of caring for elderly parents, trying to deal with responsibilities at work, trying to be a good partner, a good spouse. I mean, yes, there are all those things, but where are you in all of that? And I've actually gone to the extreme of getting out my prescription pad and saying, here's your prescription, at least 30 minutes of you time with fun every day. So that's a reasonable thing. Take 30 minutes to think about what is fun for you and what do you do for you. It's not selfish, it's an investment in you. So PMS and PMDD are often sort of put into one category, but they're two different things. PMS, premenstrual syndrome, is experienced by about 80% of women in their reproductive years. It's roughly between 11 and 45 years. So 80% of those women in that age group will experience premenstrual syndrome, which is pretty much the physical syndromes of breast tenderness, sense of carrying more fluid in the fingers, wrists and ankles, headaches, and a bit of grumpiness. So these are symptoms that are universal, and yes, there are many, many lifestyle issues. There are vitamins, vitamin B6 for example, there are over-the-counter preparations and good healthy eating, watching alcohol, making sure that that's not an issue, etc. that are really helpful lifestyle issues for PMS. PMDD, on the other hand, premenstrual dysphoric disorder, is a major depression that affects maybe 15 to 20% of women in their reproductive years, and it is a serious, significant major depression that happens about 7 to 10 days every month for some women, and it's awful. This is a debilitating depression where women describe not being able to think, so brain fog, not being able to get out of bed in terms of having poor energy, having really bad depressed mood, feeling intensely sad to the point of even thinking about suicide or making an attempt or completing it. There's also changes in appetite, there's changes in libido, and the whole picture is a dreadful, depressive picture. For this group, the lifestyle aspects are not really going to help. There are important psychological help that is available. So specific psychotherapies if there's been trauma in the background to deal with that and to start working through that. There's also hormonal treatment that can be very useful, and that comes in the shape of one particular mood neutral pill. Not any pill, but one that contains estradiol and normegestrol. Plus also extra hormonal treatment with estradiol if needed, and also sometimes coexisting work with an antidepressant medication. So unfortunately for this group, PMDD, lifestyle issues, not going to be that great. But we do have lots of things that can be of help. So this is a very complicated question, but it's got very familiar bits to it, because the question is really about lithium usage, but it's also about the diagnosis of bipolar disease. And I take that the second question first, because the diagnosis of bipolar disorder, especially type 2, I believe is made far too frequently and without due consideration of the fluctuations of the hormones, the gonadal hormones at the perimenopause. By this I mean during the transition period from about 43 onwards, for at least 10 years, there's huge fluctuation in estradiol in the brain, progesterone, testosterone, and all of the precursor hormones to these. They in turn cause changes in the actual brain chemistry and the brain circuitry. So it's not uncommon for women in the perimenopause to have sometimes where they say their thoughts are racing or they've got a bit more energy for a couple of weeks, and then all of a sudden crash and feel really depressed and sort of not even be able to get out of bed for a couple of weeks. And that to some people looks like bipolar disorder, but it's not. It's actually perimenopause, or the changes of the early stages of menopause. So that's my first point. Not everything that looks like bipolar is actually bipolar. And you've got to think at least 3-4 times before making that diagnosis in someone who doesn't have a history of bipolar disorder. Number 2, yes, lithium can cause endometrial hyperplasia, but I think we've got a whole range of other things that we worry about in the middle-aged woman receiving lithium treatment, in particular her thyroid. So I would have thought it'd be nicer for this particular woman if she could be stabilized, if she has true bipolar, and I stress if she has true bipolar, it might be worth thinking about a mood stabilizer like lamotrigine. And in particular, if there is a background of trauma, then that would be a pointer that the bipolar disorder diagnosis isn't accurate, and also that this person might do better with a different sort of treatment. The third bit is the blood tests. There is absolutely no point doing blood tests that measure taking a sample from the cubital fossa or from wherever we usually take blood tests to check blood levels, because the brain is what is at stake here, with the symptoms of perhaps some hypomanic symptoms, some depressive symptoms, some brain fog, and so on. And we're not going to be able to measure those at all with any of the blood tests that are available. So ignore the blood tests. Obviously, this person who's receiving lithium is going to need blood tests for those aspects. That's lithium levels and also thyroid and bone marrow functioning. But apart from that, please, let's get rid of the notion that we can think about the brain function in menopause with blood tests. That's a waste of money, it's a waste of time. So many times women who've had postnatal or perinatal mental health issues, such as anxiety or depression, or even OCD, or things they haven't had before, can relapse with exactly the same kinds of symptoms once they hit the perimenopause or start the menopause transition around 45 years of age and onwards. So this particular question comes from a woman who has had perinatal anxiety and is now experiencing perimenopausal anxiety to an extreme level that's manifest by having some OCD symptoms, obsessive compulsive disorder. This is not true obsessive compulsive disorder, and since it has arisen out of nowhere, we have to speculate and hypothesize that it's the menopausal hormone shifts that are creating this disturbance, that is anxiety that's expressed as OCD in this particular person's brain. And we know that this particular individual is sensitive to hormones because that's what happened when she had her babies. So there's a pointer. Many women who have PMDD, premenstrual depression, as a younger woman, who then go on to have perinatal mental health problems, are very likely to have perimenopausal symptoms. So you can see that there's a hormone link running through each of these 3 life events, and that's what's happening for this particular person who's asked this question. So my suggestion is, and I realise that she's told us that she's having hormone treatment, but we're going to have to carefully up-titrate that to make sure that she has the right dose of estradiol in particular going into her brain, because that's going to be the most significant treatment. The real red flags here are that she's not had mental health problems before and that she had similar picture perinatally. That's telling us that it's the hormones creating havoc at this stage. That means that standard antidepressant treatment or standard anti-anxiety treatment are not really going to work, nor is the standard OCD therapy, because everybody thinks that OCD is going to respond to psychological therapies, but this is a different form of it. So we've got to have to tackle this with hormone strategies, and yes, they can take a while to kick into maximum effect, but if by about 3 months on hormone therapy it's not really hitting the spot, then that needs tweaking. Because we talk about hormone therapy as if it's one thing. It's not. There's lots of different types and doses, and we have to get that right for the individual. And it's personalised medicine because each individual will require tweaking to suit her symptoms. But there is a good solution, because we know that she went back to a good mental health level after the perinatal anxiety was relieved. So we pretty sure that she's going to go back to a good level of functioning once the menopause hormones are stabilised. So the question is about when to seek professional help for anxiety. And really, I think the fundamental question is the anxiety destroying your quality of life? Is it that you're not able to carry out your work in a way that's satisfactory to you? Or is it that you're not able to carry out your relationship or feel joy? Sometimes, not all the time. I don't know anyone who feels joy all the time, but it is important for each individual to assess, because some anxiety, of course, is useful. I mean, we wouldn't do anything if we didn't have some anxiety. It does drive us to achieve, to strive, and to also safeguard our loved ones and ourselves. But it's when it gets out of that useful box and it starts to erode the quality of life that's when professional help is needed. And it's always about stages, because the first sort of talking therapy help may be the best help to start with, and it may even in fact resolve the problem. So I think we've got to take a graded approach and start with the most accessible talking therapies, which your general practitioner may be able to offer you, or there are online help with various types of anxiety treatments. CBT, cognitive behavioural therapy, if there's a specific target or focus that's causing the anxiety, may well be helpful. So it's always less is best. So try with the simple things first. Look at lifestyle. Are there things that are really getting in the way that are creating anxiety that can be tackled and handled? And also the talking therapies first of the different types. Start with your GP, who may refer you to a clinical psychologist if needed. Down the track, if you're still not getting anywhere with the talking therapies and you've given it a good bash for at least 6 months and you've had a decent helper or professional helping you with this, then you may need some medication advice for the anxiety. And there are some over-the-counter medications that might be useful in the first instance, and then eventually you might need psychiatric help to help determine whether your anxiety is part of a bigger picture problem, such as depression with anxiety or something else. But I think take it gently at first. Make the decision based on your own quality of life disturbance, then go for talking therapies, give that a good go, and then you may need medication or other investigations and help.